Well, many of us assume that doctors and nurses understand the importance of hand washing, so germs aren't transferred from patient to patient. But many are falling prey to what's called the Hawthorne effect. Our chief health editor, Dr. Nandi, is here now with more on that. And what is the Hawthorne effect?
Hawthorne effect is when Stephen Clark is sitting next to me with a bag of Doritos, and he looks at me and goes, "Oh!" and he puts it down. So basically, when someone changes their behavior because they know they're being watched. In this study, researchers found that when doctors and nurses at the medical school thought they're being watched, good hygiene practices occurred about 57% of the time. Now that rate decreased and plummeted to 22% when health professionals thought they weren't being evaluated. So that's what's happening.
Now these are health professionals. We're expecting a little bit more here. What's going on?
I know it's not an excuse, but here's the thing, we get busy, right? We get busy and often get caught up in what we're doing. But that doesn't mean it's not important. This needs to be a higher priority for all of us, including myself, all the time.
Your prescription for hand washing.
Yeah, absolutely. Not just for us, but for everybody. Wet your hands, first of all, with warm or cold running water. It doesn't really matter what the temperature of the water is. The CDC says that prevention, it doesn't seem to affect the temperature at all with how much germs are removed. Also, use liquid bar or powdered soap. Avoid antibacterial soap. Antibacterial soap is not more effective, and it could lead to germs developing resistance and make them harder to kill in the future. Also, scrub your hands for 20 seconds and then rinse to make sure lather everywhere, including the back of your hands. Tell your kids about 20 seconds. And if soap and water are not available, use alcohol-based sanitizer. Make sure it contains at least 60% alcohols.
Now, should patients mention hand washing if they don't see their healthcare professionals?
Actually, patients get a little intimidated, but be your own health hero, right? Speak up and say, you know what? Just ask the nurse and doctor if they've recently washed their hands, and it's acceptable because it's your body, and it might keep you from getting an infection.
All right, some good tips there. And, being the grandson of a nurse, I definitely learned how to wash my hands.
Exactly.
Pretty good at it.